we're going to stick with Thursday from here out, although, of course, next Thursday is Thanksgiving. So next Thursday I'll be here Wednesday at 1, and then for the rest of the year, Thursdays at 1. So before I go through the data, as I always begin with, I do want to start with some good news, because there is good news and there is very definitely light at the end of the tunnel. On Monday of this week, biotech company Moderna announced that its initial vaccine results show that it is 95% effective. That is a stunning result. In contrast, the flu vaccine, that we receive every year might be 50–60% effective. On Tuesday, Pfizer announced that Rhode Island will be one of 4 states in America piloting its distribution of its vaccine. So that will ensure that we here in Rhode Island are ready to hit the ground running the minute that vaccine is approved and available. I had reached out to the executive team at Pfizer about a month ago asking if they might consider Rhode Island as a pilot, and I'm very pleased to say that they have chosen us. It does not mean we'll receive the vaccine sooner than other states. What it means is we're working with them already right now, getting the conditions in place for logistics, how we distribute it, how we store it, so that Rhode Island will be ready to go the minute we have it. That vaccine also, according to their clinical trials, is also about 95% effective. And in the coming days, Pfizer will be seeking authorization from the FDA, and they anticipate producing 50 million doses by the end of the year. So why am I sharing this? I'm sharing this because there truly is light at the end of the tunnel. This has been a very long journey that we have been on together for the past 8 months. I think we're now in the 7th inning. We are not there yet. It is my estimation that the 6 weeks before us will be the hardest yet of this crisis. But it is also true that we're closer than we've ever been before to an effective, available vaccine, which will be a game changer in how we manage coronavirus. However, between now and then, we have a lot of work to do. So I am hopeful that there will be some amount of vaccine available in Rhode Island by the end of the year. And I am hopeful that there will be even more in January, February, March, and by spring it'll be quite available. But we have to get there. And what is weighing on me now is not overwhelming our hospital system between now and the end of the year. And we all have to vow to do whatever we need to do to make sure that that doesn't happen. So today, I'll ask you to bear with me. I have a number of announcements, and I'm going to lay out a path to get us from where we are to the end of the year without overwhelming our hospital system. So now we'll begin with the data, and I'd ask you please to put that up on the screen. It's been about a month since we started introducing some new limited restrictions. And I'm very sorry to say that despite those targeted restrictions, things aren't getting better. Yesterday, we had 921 new cases out of about 16,000 tests for a percent positive of nearly 6%. And we saw another 4 deaths. You can see the weekly trend data on your screen, and frankly, it's alarming. There's nothing there that we want to see or that should give you any comfort. For the first time since our peak back in the spring, we've surpassed all 3 thresholds, and every arrow is red and pointing in the wrong direction. Our weekly percent positive rate is about 6%, 5.9%. That's up a full 2 percentage points from the week before. Nearly 250 people, 247 people were hospitalized last week alone because of COVID, with single-day hospitalization numbers in the 30s and 40s. We haven't seen that since the spring. And our new cases per 100,000 skyrocketed to 535. It wasn't that long ago I was up here saying we were at 70 or 80, wanting not to get to 100, and now we're over 500. And we've had multiple days in the past week of over 1,000 new cases a day. Now, you know that I have tried to avoid any sort of a lockdown or stay-at-home order. And over the past month, I have tried to get a handle on the virus by having targeted restrictions. And I've been up here week after week after week after week with targeted restrictions. I lowered the social gathering limit, prohibited parties, asked offices to go back to remote work, limited indoor sports, put a curfew on bars and restaurants. Last week, I thought we had very powerful testimony from Dr. Foreman, who's an emergency room doctor and who will be running the Cranston Field Hospital. I've been begging and pleading with the people of Rhode Island to stop having parties, kids who play sports or wanting to have sleepovers, to knock it off, asking everybody to cut it out and get rid of the parties. But unfortunately, it's not working. For whatever set of reasons, although we all seem to think we're following the rules, clearly we're not, because we're in a really bad place. So I have done everything that I knew how to do to avoid the severe restrictions that I'll be laying out today. And the reason for that is because I know this is going to be tough. And I know this economy is hanging on by a thread. And I hear from businesses every day who are hanging on by a thread. And so I have tried to hold off as long as possible with tougher restrictions. But the truth of it is we're past that point, and I have spent the past days poring over the data, working hand in glove with hospitals, and we are on a very bad path to overwhelm our hospitals, so something more has to be done. So let me begin, before I tell you what we're doing, by telling you what I know, what I don't know, and why I'm making the decisions that I'm making. First, I've been straight with you from day one. With so much community spread now, it's really hard to precisely pinpoint people where we can trace the source of infection. It's not always possible to trace the exact source of every infection. At one point it was. We can't do that now. People are increasingly mobile, and it's difficult. Some people aren't even answering the questions that we're asking when the Department of Health calls. Now, in some cases, it's crystal clear that there's a super spreader event, and the kinds of those events keep popping up. Birthday parties, baby showers, at-home social gatherings are crystal clear spreaders. That we see over and over again. In other instances, you have people who've been to 15 places in the past week. They've been to work, they've been to school, they've been out to dinner, they've been to parties. So you can't always say exactly which place has been the source of spread for that person. I can say this. If we had done a better job of controlling our social house parties, I would not be up here today with tougher restrictions on businesses. And for those of you who are out there saying, it's no big deal, come on, let's have a birthday party, it's only 15 people, let's have a sleepover, high schoolers will be high schoolers, kids will be kids. I want you to know a lot of people are going to lose their job and maybe their lives because you're taking that approach. And I just ask you to think twice before continuing to do that. So there is a lot we do know. We've worked with IBM to do an analysis of case interviews and identify trends. We do have a lot of data at this point, And we know that there's some clear patterns among people testing positive. People are having, as I said, these social gatherings, mostly at home, going to restaurants and bars, and they're hanging out a lot with people outside of their household. That is a very clear trend. The more mobility people have and the more contact they have socially with people who they don't live with, that's causing a great deal of our problems. We also know that a significant driver of mobility is restaurants and bars. We've seen a decline in overall mobility after the 10 o'clock, which corresponds with the early closure of restaurants and bars. And a Brown University mobility study likewise found a very close correlation between increased travel to restaurants and increased spread of COVID. I know I need to reduce our mobility and reduce our connectivity with people outside of our household if we're going to get a lid on this. We know there's high compliance with mask wearing when people are shopping. We know it's impossible to keep your mask on when you're at a restaurant while you're eating and drinking. You necessarily take your mask off for a lot of the time you're there. We know there's much lower compliance with mask wearing when folks are at a social gathering in somebody's house. Much lower mask wearing when you're with your friends or your extended family. And we know that settings where people are moving around a lot and where people have occasion to be closer than 6 feet and not wearing a mask are where the virus spreads. We know the virus spreads much more easily indoors than outdoors. And we know that schools are not major spreaders. We know that in Rhode Island, we know that in 50 states in America, and we know that in dozens of countries around the world. Not a shred of data to suggest schools are major spreaders. However, we do also know in Rhode Island that high schools are more problematic than elementary and middle schools. How do we know that? Because every school that has had 10 or more in-person student cases since school has reopened is a high school. Every single instance that's had 10 or more cases has been a high school. Because high schoolers are more mobile. They hang out with their friends on their own after school. They participate in sports and extracurriculars. They might be doing errands for their family. They're very mobile while they're at school, walking around. A lot of them have a job, so it makes sense. So this is what we know for a fact, based on our own data and on trends in other states and in other countries. As I said, I'm not going to pretend that we know with great specificity exactly how everyone in Rhode Island has contracted COVID. So I have to make decisions in the face of a lot of uncertainty, and I'm going to do my best. And I have to anchor on what is true, what is science, what is fact, what is data, and what the health experts are telling me. So we have to reduce mobility. We have to eliminate social interaction between households indoors. We have to reduce social activity indoors. And we really have to clamp down if we're going to make it to the end of the year without having catastrophe in our hospital systems. So with that as the backdrop, I want to outline our path ahead between now and the end of the year. And I'm talking about, this is different, I'm moving beyond phase 1, phase 2, phase 3. This is the last mile. We have to get through this year, we have to get to a vaccine, and we're in a critical place right now with our hospitals. It's a tipping point. So I want everyone to kind of focus on here to the end of the year. So number one, we're extending our current guidance another week through November 29th, the Sunday after Thanksgiving. So what does that mean? That means bars and restaurants will continue their early closures, just as they are now, and current capacity restrictions at venues of assembly and retail will stay in effect. I just have two changes for the next 10 days, effective immediately. Number one, the social gathering limit is lowered to a single household. If your household is 2 people, you should limit your social gatherings effective immediately to those 2 people. If you live in a house with 6 or 7 people, that's your social gathering limit. You cannot be spending social time indoors with people who you don't live with. Second, in addition to the stricter capacity limits at big box stores, which is any store over 30,000 square feet, we are going to require them to develop a plan for handling the increased volume of shoppers that we expect to see next week and with Black Friday. We're also going to be requiring retailers not to let folks in the store if they don't have a mask on, and to be passing out masks at the door. I want to say a word about Thanksgiving and what this means for Thanksgiving. If you already have your plans made to go out to a restaurant, we're not going to get in the way of that. I'm going to ask you to use extreme caution and wear your mask. I have asked you for weeks not to travel. I'm going to ask you again not to travel. What you have to do, what you should do, is stay at home with the people you live with and celebrate Thanksgiving. That's what I'm going to do for the first time ever. It's going to be weird. My kids are really upset. It's going to be hard. But it's what I'm asking everyone to do. If you insist on traveling over Thanksgiving, and I am begging you not to, and travel is any travel. I know someone's going to say, but can I drive to Massachusetts to see my grandmother? Can I just go to New Hampshire to see my uncle? No, you shouldn't do it. I'm asking you not to do it. I'm asking you to stay at home and hang out with the people that you live with. But if you're going to do it, and that means you're breaking the rules and putting people's lives at risk, but if you have to do it, I want you to get tested before you go. I want you to follow the rules wherever you are, including wearing your mask, even with your family. And I want you to get tested when you come home. To that end, we will be offering rapid testing in the airport at TF Green Saturday, Sunday, and Monday after Thanksgiving. We're also going to have a team of the National Guard at the airport reminding you that when you come back, you have to get tested and you have to quarantine. So for Thanksgiving, I'd like you to keep it local, keep it to your household, not travel. If you have to travel, please get tested before, get tested after, and you must quarantine when you come home for 14 days. And to make it easier for folks, we're going to have some testing at the airport so you can get tested with the Binax right there at the airport. Okay, that's Thanksgiving. Now we'll talk about what comes after Thanksgiving, and this is the really hard part. Beginning on Monday, November 30th, the Monday after Thanksgiving, the state of Rhode Island is entering a 2-week pause. This is key. This is the crux of our winter strategy working. We really got to shut it down for those 2 weeks. Because if we do, then we can slowly crank up after those 2 weeks and make it through the end of the year. If we don't, then the shutdown will have to continue. After a lot of modeling, a lot of consultation with experts, a lot of talking to other states, we have confidence that if Rhode Island cooperates and complies for 2 weeks, beginning November 30th until December 13th, we have a real shot to temper the rise, which would allow us to limit the pause to just 2 weeks. If we don't, then I will have to go back to a total lockdown after the 2 weeks. So what's the pause going to look like? Please put the slide up. The slide in front of you shows the rules that will be in effect in Rhode Island starting November 30th through to Sunday, December 13th. On your left, you see the categories that are remaining open. All pre-K, elementary, and middle schools will stay open for full in-person education of our children. I have talked at length at these press conferences about the vital importance to our community, to our families, and to our children, particularly our youngest learners, of being in school as much as possible. And so we want to keep these kids in school with all the precautions we have, and we want that to happen unabated. And the data and the health experts continue to say there is no evidence to suggest this is unsafe, and in fact there's mounting evidence to suggest our children are truly suffering by not being in school. Likewise, child care, which is essential for working parents, and we in Rhode Island have been able to operate very safely. We've become a national model, will remain open during the pause. Same is true for manufacturing and construction. We've had a few outbreaks, but by and large, good compliance. And these are jobs that can't be done from home. It's critical work, so we are allowing them to stay open, but we are also coupling it with increased testing of asymptomatics in those industries. Personal service industry, barbers, nails, haircuts, doing a great job of implementing safety precautions, and we have no evidence that it's a vector of spread or a driver of mobility, so we're going to leave them open. It's also true that you can leave your mask on the entire time you're getting your hair cut or your nails done, which is different from, say, dining out. Healthcare appointments are going to remain open. It is my #1 goal between now and the end of the year to allow the hospitals to remain open for full functioning, and all doctors' offices and health offices to remain open. So please don't put off your visit to the doctor, don't put off your visit to the physical therapist, don't put off your immunization or your child's immunization. We need to stay healthy. So we're going to keep those open, and I want to encourage everybody to go ahead and do that. Back in the spring, folks stopped seeing their doctor, and that was bad. Kids got sicker, we got sicker. Please don't do that. We're going to keep all health facilities open. Now, the reason I'm announcing this today, but it's not going into effect until the 30th, is because I want everybody to have some time to get prepared, because the stuff that comes next is tougher. In that middle category on the screen, for the 2-week pause, we're saying limited. So with respect to high schools, we're giving superintendents the flexibility to shift their high schools to their limited in-person plan if that's what they choose, after Thanksgiving. So next week in school's on as it has been. Starting the Monday after Thanksgiving, if high schools want to, they can switch to their limited in-person plan for the duration of the school year. It amounts to 3 weeks, because after the 3 weeks, their kids are off for winter break. By the way, this is exactly why we had every school district plan for different scenarios. So they already have their limited in-person scenario ready, and we're suggesting if superintendents want to take that option, you're allowed to go ahead and do that. For the districts who do choose this path, most high schools will shift to virtual learning for most of the students. However, there are exceptions for certain students that have special learning needs, multi-language learners, and others who need in-person instruction. Those kids should still be taught in person in school as according to your limited plan. Now, I know that certain high schools, we've already heard from some superintendents who have extremely low infection rates, who are able to dedensify, and they're keeping their kids in school, and I think that's great. Good luck, and let us know how we can support you. It's good for the kids, and I think that's fantastic. The social gathering limit, taking effect today, will continue in the 2-week pause. So just tell yourself now that for the next 3 weeks, you're not going to hang out socially with people you don't live with. Just don't do it. If you have to do it outdoors. If you want to visit somebody briefly, stay outside. But indoor social gatherings, starting now for 3 weeks, keep it to the people you live with. In the pause period, indoor dining is going to need to scale back to 33% capacity. The current early closure of 10 o'clock on weeknights and 10:30 Friday and Saturday will remain in effect. And restaurants will be required to only seat members from the same household together at one table, and to make it clear that that is the case when you're taking reservations. Outdoor dining does not count toward the capacity limit, and restaurants can still provide full takeout and delivery service. This is tough. I know this is hard. I want to give special thanks to Dale Venturini of the Rhode Island Hospitality Association and the Ocean State Coalition. We worked hard and closely on this. I know you're not happy with this. It's the best we could do. And I also heard you loudly and clearly that if we made these changes effective immediately, there would be a massive amount of spoilage and difficulty to get through next week. So I appreciate your help, and I'm counting on you to enforce these rules. In the pause period, you got to crank down the restrictions to 33% of capacity and only one household per table, which I know is a burden for you. But you've led me to believe you can do it, and I want to say thank you, and I want you to know if everyone in Rhode Island does what we need to do for 2 weeks, this pause should only last for 2 weeks. Retail will stay open during the pause with their existing capacity limits, 1 person per 100 square feet for most retail, and 1 per 150 square feet for the big box stores. We know people are good about wearing masks in stores. We've had great compliance, and so I'm grateful for that. I would say I'd ask the people of Rhode Island to shop local as much as possible. You know, no disrespect to the big guys, Walmart, Target, etc., but our little guys are really struggling. So if you can do your shopping local, please do it. For the holidays, go out of your way to shop local, and also please go out of your way to shop online local, because that'll help the economy and keep us safe. Houses of worship can remain open during the pause, but with a maximum of 25% capacity. And I would ask you to please celebrate virtually. It's only 2 weeks. It's 2 weeks. The pause is 2 weeks. So please celebrate virtually if you can, but otherwise the maximum we could have in a house of worship at any time is 25% capacity. Okay, finally on the right you'll see areas that will be closed during the 2-week pause. We're asking colleges and universities to end in-person instruction after Thanksgiving. And we announced yesterday that we're joining all of our states in the region to have colleges test all students before they leave campus. Thank you to higher ed for your extraordinary cooperation through all this. During the pause, I'm asking all offices to move to remote work for every employee who is able to do so. I understand not everybody can, so I said manufacturer, construction, different things, healthcare. But if you're an office worker, a lawyer, accountant, in finance, whatever, during the pause, please work from home. If you need a hand figuring out how to do this, call 521-HELP. During the 2-week pause, bars in Rhode Island will be closed. All bar areas in restaurants and bars will be closed for the 2-week pause. Drinks can be served to customers eating their dinner or eating their meal when the drink is delivered to the table as people are eating. Again, I know that's a tough one, but it's necessary. Recreational venues, bowling alleys, theaters, our Twin River Casino will be fully closed during the 2-week pause, as will indoor sporting facilities, gyms, and all group fitness classes and organized sports, including high school sports, everything other than college and professional sports, they have their own rules. This is very difficult, particularly for the indoor sporting arenas that just did an unbelievably great job to help us figure out regulations. It's my hope that after the 2 weeks we can go back to those regulations or similar regulations, but there's just no way around it. We need a hard pause if this pause for 2 weeks is going to work. I do want to say that thankfully we have some of our stimulus funds left, and I will be back out next week with the details of a significant tens of millions of dollars of stimulus for these small businesses that are going to be most affected during the pause. I don't know exactly today. My goal is to have it be significant, tens of millions of dollars, to have it get out the door fast, and to have it be simple. And when I address you next Wednesday, if not before, we'll have all the details. I know this is going to be hard on gyms and recreational facilities and restaurants and bars. We're not going to leave you hanging, and we're going to get out next week with significant stimulus. Thankfully, we still have some available. Okay, this, as I said, the pause doesn't take effect for 10 days. So everybody can take a breath and get ourselves ready mentally and in our businesses and in our personal lives for how we're going to hunker down for the 2 weeks that begin November 30th. You undoubtedly have 1,000 questions right now. What about this? What about that? How does this exactly affect me? In the coming days, we're going to have detailed regulations online at reopeningri.com. Reopeningri.com. We're going to try to have that up by as soon as possible. As soon as possible, we'll have some details around how this affects your particular business. What I will say is none of this is going to be easy, and I really wish I didn't have to do it. I really had hoped to avoid this because I know the financial pain that's going on in Rhode Island right now, but I'm in a world of all bad choices, and I'm trying to pick the least bad of the options, and I am trying to get us through to the end of the year without overwhelming a hospital system and with the limited amount of harm to health and also to our long-term economy. If you're wondering why I'm waiting until after Thanksgiving to do it, as I said, first of all, I want people to be able to prepare, especially restaurants. I know you purchase food, you've already laid out the money for inventory, and so I want to give you time to reorient your businesses. Also in our own lives, this is going to be hard. I know a lot of moms who live just with their baby or their child, and like, what am I going to do alone for 2 weeks? So I want you to think about how you're going to get through it. How are we going to get through it? Secondly, this is only going to work if we do it. I don't know how to say it any other way. This is only going to work if we decide to do it. So if you're out there now asking yourself how you can get around the rules, this isn't going to work, I'll be back here in 3 weeks and it'll be a full state lockdown. I'll tell you that right now, because I'll be out of options. But if you're out there now saying, okay, how can I adjust? How can I live my life essentially in my home for those 2 weeks, just interacting with my family? Then at the end of those 2 weeks, we can start to turn the dial back up to allowing a bit more commerce. So here's the reality. There's a lot of really funny memes going around about me showing up in people's living rooms. I kind of wish I could do that, because if I could, then I wouldn't have to shut down businesses, which is painful, because people deserve to be able to work, and children deserve to be able to go to school. But I have been utterly ineffective in getting people to follow the rules in their own homes. So since we can't do that, then this is the way we have to go. We have got to turn down our mobility, shut down our indoor social gatherings without masks. Got to do it, please. Because if you do, then some folks can get back to work. Okay, a few more things. I want to talk about hospitals. I want to talk about how we'll know if this is effective, and then I want to talk about hospitals. Within 2 weeks, we know there's a lagging effect. But there are also some leading indicators which will tell us, is the 2-week pause working? So we are going to be measuring test positivity. We want to see our test positivity below 5. Test positivity is a leading indicator. So hopefully, if everyone is actually doing the pause properly, as we go through the 2-week pause, at the end of that pause, our test positivity will be going down and will be below 5%. We're going to look at reservation data at restaurants. We're going to look at mobility data. We're going to look at traffic data. And we're going to look at enforcement data. And we ought to be able to see, are people staying home, not going out, not on the roads, and is our test positivity going down? And if it is, then I can start to think about, as I say, turning the dial back up. If it's not, depending on what it looks like, we'll either have to get tougher and more restrictive, or we'll maintain the pause longer. As I said, the pause only works if we take it to heart. I've been asked so many times, Governor, are you going to send the cops to people's living rooms? No, we can't. I'm asking the people of Rhode Island to do the right thing when no one's looking, when they're in their house. I want to give you a glimpse into what it's going to look like pretty soon if we don't start wearing our masks and following the rules. Currently, right now, our hospitals are at 97% capacity of their COVID beds. And dozens of folks are showing up every day. The field hospitals are ready, but what we want to do is avoid rationing beds, limiting care, overwhelming the hospital, and turning off non-critical procedures. So the plan that we have includes opening the Cranston Field Hospital and the Convention Center. But I want to say this. If the system gets overwhelmed, if we just have too many people too quickly, then our backup option is to make beds available by clearing out other beds in the hospital, which means shutting off other important procedures. You know, we think of them as quote-unquote electives, but these are important procedures that we would have to cut off. Heart surgeries, brain surgeries, preventative care, cancer screening. Every doctor will tell you that they're seeing more developed cancers now because people canceled their screenings in the spring. So we want to avoid all of that. Dr. Alexander Scott literally is up at night afraid that we're going to have to go to crisis standards of care. And what does that mean? I'm not trying to scare you. I'm just trying to tell you the reality of where we are. The hospitalizations today are increasing at a faster rate than they were at our peak in the spring. Lifespan and Care New England are doing great work. Our Cranston Field Hospital will be ready for next week. The Rhode Island Convention Center Field Hospital will be ready by December 1st. Currently, with our cases, we're on a path to open Cranston and need it by the week after Thanksgiving. And we've been working very closely with Lifespan and Care New England, where we have certain triggers, and it's in their capable control on when they decide to open the hospital and start funneling patients to the field hospitals. Due to the Herculean efforts of the building trades and so many people, we got the hospitals built quickly in the spring. We have 900 beds. The hard part's staffing them. It's the staffing. There's massive shortages all over the country, and people are tired and burned out, frontline healthcare workers. So it's the staffing where we'll get into trouble. And what the hospitals are doing now, to give you a flavor for how we're going to figure out how to staff, they're reassigning staff, working with colleges and universities to engage student nurses, student doctors, medical students. Going to have to engage outsourcing some healthcare professionals, onboarding new employees in partnership with Skills for Rhode Island. But I want to be clear, this is going to be really hard. 97% of our COVID beds are filled. And our cushion, if you will, the way we get beds quickly if we overrun our field hospitals is to start shutting down other procedures at hospitals and to go to crisis standards of care. And any doctor who's been, or a nurse or a patient, who's been around for crisis standards of care will tell you, you don't want to be there. And I don't want us to get there, and we shouldn't have to get there. But we have to do what we're saying with the pause. So this is the goal. The goal is get yourselves ready now to have a Thanksgiving alone at home with your people you live with. Don't travel. Starting November 30th, 2-week pause. If we do that, I think we will be in good shape with our hospitals and our field hospitals to get us through to the end of the year. If we don't, we'll somehow get through. We will get through. We have 900 beds in field hospitals. We have great medical professionals, but it will be really tough, really ugly, a lot more pain, suffering, and mortality than there needs to be. So to me, it seems like a pretty easy choice. But it's gonna suck. Like, I hear it already. My kids can't play sports. I can't go visit grandma. I'm gonna have to close my bar. Yes, it's where we are. I hope it's the last time we're doing this. And trust me, if I could have figured out a way to do this without these draconian measures, I would have. But when you get inside of what's actually potentially going to happen in our hospitals if we don't do this, it's not a place we want to be. So I'll own these decisions, which aren't easy. But I feel it's the only option we have right now to save as many lives as we can. Because I have friends with cancer, and I have friends with heart disease, and I have friends who are out of work, and I don't want them to not be able to go to the hospital or the doctor. And I don't want my friends to be out of work so the rest of us can have parties and hang out with our friends. So hang in there, and we'll get to the end of the year. After we finish our pause on December 13th, I'm not going to flip the switch and say back to where we are now. As I said before, it'll be a dial. I'm not announcing today what that will look like, because I can't, because I have to play this a day at a time, a week at a time, and see how it goes. Okay, as we continue seeing the big spike in cases, we also are seeing a big increase in demand for testing, which is a good thing, and I want to say thank you for coming out to get tested. Good news is we're still testing among the most in the country. We do a lot of testing. We've run about 100,000 tests in just the last week. But honestly, I'm sorry to say, we're struggling to keep up with demand. And I know that is frustrating, and I'm sorry. We're going as fast as we can, but I know it takes days to get your test. I've heard from a lot of you. It's taking too long to schedule. We're behind. We're going to get better. We're on it. We're going to get better. We already are getting better. I can tell you today that we've made the following changes. We have just added an additional 2,000 daily tests to our asymptomatic testing capacity, effective today, and an additional 300 daily tests for people with symptoms. We are expanding the testing site at Wickford Junction, and today have added a new site in Pawtucket at McCoy Stadium. We're also going to be adding additional sites at the Meadowbrook Waldorf School in South Kingstown and the Stop and Shop in Greenville. We're going to continue to expand capacity and add new testing sites over the coming weeks. So here's the goal. Between now and when our pause begins, we want to get to a path of doubling our tests. So in that period of the pause, I want to be doing twice as many tests a day as we are now. That's a heavy hill to climb. And thank God for our testing team and our National Guard and our Department of Health experts. But that is our goal. The goal is to crank up our testing to the max. So I'm sorry if it's slow. Continue to go ahead and try to get tested, and know that in the next 3 weeks, you'll start to see it gets better and better. I also want to be honest and say it's no secret that our contact tracing system is behind. We're working on that too. We added 100 new staffers just this week to shore up the system, and we're going to continue to add staff. But I need your help. Go get tested. After you get tested, check the results portal frequently. It's online. You can check yourself. portal.ri.gov/results. As soon as you find out you're positive, don't wait to get a phone call from the Department of Health. Go home and put yourself in isolation and call everyone you know you were in touch with. Just do it automatically. Go ahead and get tested. Keep checking the portal, the results portal. The minute you find out you're positive, do me a favor, pick up your phone and let your friends know. Hey, I was with you yesterday, I'm positive. And then that person should go get into quarantine and should go get tested. And you, please, isolate yourself. Don't wait to be told. Right away, go home. One of the things that we are also going to be doing in the weeks ahead is increasing our support for low-income folks who have to isolate. We know certain communities like Central Falls, Providence, areas of Providence, Pawtucket are on fire with the virus. These are low-income communities where a lot of multi-generational families. We know it's hard to take a day out of work, and it's also hard to isolate if you live in a big family home. So we're going to be increasing the amount of hotels that we make available for people to isolate, food delivery for folks who need food while they're isolated. And to that end, I want to thank Mayor Alorza and Mayor Grebian and Mayor Diosa. They're working really closely with us in their communities, and Mayor Alorza and Mayor Diosa have made some tough decisions on their own in their communities, and I want to thank all of them.